Good afternoon, everyone. My name is Sofia Gaylock. I am a colon cancer survivor. I'm currently in chemotherapy, and I'm here just to give you a little bit on my experiences, and hopefully I can give you some encouragement so that in the case that you are in my position, you know exactly what to do in order to make it an experience that will be positive for you. Okay. I remember in April of last year, I was feeling a little fatigued, but I didn't pay much mind, just figured it's because it's work related. And then I went for my annual physical back in August, and my PCP at that time, was still my PCP, called me a couple of days after my physical and asked me if I was sitting. I said, no, I just got out of a car, I'm standing. Well, I think you need to be sitting. And I said, no, tell me what is it, what's wrong? And he proceeded to tell me that my blood count was extremely low, and so was my iron count. I said, well, I figure that's normal because I did suffer from a little bit of anemia. So he went to say, no, it's a lot worse than anemia. In cases like these, we get extremely worried, and there's several things that could be the cause of this. So I said, okay, let me get into the house and then we'll talk some more. So I got into the house and we were talking, and he said, well, there could be one of two causes. It could be something gastro-related, or it could be something hematology-related. So I said, well, what do we do? So, well, first things first, I want to make sure that you are well enough, so I'm going to schedule you to have a blood transfusion, and then we're going to go from there. So we proceeded to have the blood transfusion, and then I proceeded to have some iron therapy. And in November, I remember it was the Sunday before Election Day. I was getting ready to prepare myself for work the next day, and I came down with severe cramping. It was excruciating to the point where I was doubled over and I couldn't pick myself back up. And I was like this for about 2 hours, and then I decided to call my mom, who was quite surprised that I was up that late. And I said, Mom, I can't take it anymore. She said, what's wrong? I said, my stomach, it's hurting. She said, I'm going to come and get you. And she came with my brother, who he's not the easiest person to get out of the house once he's inside. But they came and they took me to the emergency room, and the emergency room doctors, they gave me some medicine to stop me from vomiting and to stop my stomach from hurting. And they said that I had something called acute gastroenteritis. I was out of school I work in a school, by the way. So I was out of work for the week, eating nothing but liquids, clear fluids, they call it. And I drank my clear fluids, and I went back to work the very next Monday, and I was fine that Monday. And then the Tuesday, the cramping came back. Called my PCP again, and he said, no, I think you need to go for a CAT scan. I went for my CAT scan, waited a while. I couldn't hold the liquids that they needed for them to be able to see what's going on in my stomach down. Those came back up, and so we'll still try it. I had the CAT scan. My PCP called me again. He said, I need you to go the very next day to have a colonoscopy. Now I'm hearing the word colonoscopy, and I'm saying, that sounds painful. He said, no, it's going to be fine. I went the very next day, I had my colonoscopy, and as one of the presenters said, they put you to sleep. I enjoyed waking up and not knowing that something had happened, but I didn't enjoy waking up and finding that something is wrong with me inside. I saw pictures of what my colon looked like, and there was a mass. I was a little nervous, but I figured, okay, the doctors found something, and they know that there's something wrong with me, and there's a way for them to help me. I went to see Dr. Bernstein about a week later, and he said, we have to do surgery. I'm like, oh boy, here we go again, surgery. But I still was thinking positive. I had my surgery, and then I went back for my follow-up, and I said, well, you know, I figure everything went well with the surgery because, you know, no news is good news. He said, no, we don't tell you that anymore over the phone. But your cancer was malignant, your tumor was malignant. So what's the next step? We're going to have chemo. My first thought was, there goes my hair. He said, no, your hair will be fine. I was like, okay. I went home, I told my brother once again what was wrong. All of a sudden, my brother got out the clippers. He said, no, the doctor said my hair is going to be fine. There's no need for you to bring out the clippers. Put those away. And I proceeded to alert folks in my family what's wrong with me. Everyone cried, and, you know, they hugged me and offered me their support. I went to work, and I told the folks at work, went for a visit, told the folks at work what's wrong with me. And everyone looked at me and said, but you don't look as though something is wrong with you. You don't look as though you have a problem. I said, it's not a problem. It's something that's curable. And I am getting help for it. I said, but you're smiling. I said, well, what do you want me to do? You want me to start crying and rolling on the floor? Would that make you feel better? No. I think we're getting a lot of strength from the way you're looking. Because you're smiling, you're happy. I said, yeah, I'm smiling and happy because, one, something was wrong with me, something is wrong with me, and my doctor's there on top of it, and there's a way for me to see the light at the end of this tunnel. And so, as the days progressed, and folks would call me on the phone, they said, you sound so wonderful on the phone. I said, yes, I am sounding this way because it makes everyone feel a lot better to know that it's not the end of the world. So colon cancer, colorectal cancer, it's not the end of the world. There is hope, and there's hope every day. And screening and getting on top of it and being aware of how your body is feeling is very important. It helps. And it also helps if you have a really good support group. I have a good support group in the people I work with and in my family. And I have a really good support group in my doctors. And I know that with all of these factors in place, that you also can be able to overcome this kind of disease, and you could also be able to overcome whatever other diseases are attached to it. You just need that support, and you need to have that faith in yourself and faith in the doctors and faith in your family and your support group, that once they're around and you can be able to talk about it, and you can take those feelings from the inside and bring them out and let everybody know how you're feeling and not holding it inside, that you will be able to survive anything, including colon cancer.
You're welcome.